Hatch, and I'm the Chief Executive of International Refugee Trust, a fairly small, medium-sized international development organisation. And this is Lizzie Garland, our Programme Manager. I lived actually and worked in Africa for many, many years, from the mid-80s, and more recently, for the past 15 years, I've been based here in the UK. I've seen many things in development over the years, and I've been involved with very many good projects, but the project we're about to talk to you about tonight, for me, is the way forward. I feel passionate about it and really excited. And it's quite complicated to explain, that's why Lizzie's the one to do that. But I think you'll find that it is very, very interesting. We're asking you to support one particular element of the project, but we have to explain the whole concept for you to perhaps understand how it fits in. So without further ado, I'd like to hand over to Lizzie. Thank you.
Thanks, Adrian. I'll start with the challenges that our target beneficiaries have to face. Now, could you imagine living on £1.25 a month in a country where a cup of coffee typically costs £1? Now imagine also having a family of 7 children to feed and care for on that income. Not even $1 a day. This is the reality for rural subsistence farmers living in northern Uganda. As a result of low incomes and low agricultural productivity, most households eat on average only once a day. Once a day. And this normally consists of low micronutrient, starchy staples such as cassava and maize. Needless to say, malnutrition is rife. To add to these challenges, we also know that 75% of farm work is done by women and girls. This has a devastating impact on women's health, self-esteem, and access to education. Furthermore, we know that only 50% of the children in the communities we are looking at live to adulthood. This is an unacceptable figure anywhere in the world, and it's an unacceptable figure for the farmers in Uganda. In response, we at the International Refugee Trust are supporting 2 local partner organisations to implement 2 far-reaching homegrown programmes based on an approach to development called Participatory Learning and Action, or PLA. Geographically, our partners are close enough to work together and share similar cultures. There is also plenty of scope for both organisations to replicate and expand their programmes, and our collective mission is to facilitate all subsistence farmers in northern Uganda out of poverty. So what exactly is PLA? Well, it's exactly what it says on the tin. It is the communities participating and learning and putting those learnings into action to enable their communities to become sustainable and prosperous. Since the farmers' challenges are inextricably linked to a number of factors, we've broken our programme activities into 3 sectors for holistic integration: sustainable agriculture, gender and community development, and savings and credit. We do not approach any one of these sectors in isolation of the other 2. Starting with sustainable agriculture, this covers a wide range of projects that supports increasing yields and improving quality of produce that can be sold for cash. It is important to note that nothing in these programs is given for free. People don't value freebies. All items, seeds and tools, etc. are provided on a cost-share basis or in exchange for labour. Next up is savings and credit. Households are taught how to better manage their incomes, to pay for school fees, buy items to improve their homes and start small businesses. They are also encouraged to forecast and in a way become inspirational about the future of their families. For example, most of our farmers save up to buy mattresses, a luxury item that most have never had before. This is a key example of PLA working, people having ownership over their lives and a sense of pride in their achievements and the communities in which they live in. Finally, we look at gender and community development. An important part of the programme is working to harmonise families, insisting that married couples attend training together. The commitment of the men to participate is crucial to the success of the overall programme. For example, we wouldn't be able to address the problem of the women's workload without the men understanding why. Ultimately, both male and female parties want their lives to improve and they care about each other. Within this sector also falls hygiene and sanitation, and this is where you come in. Diarrhoea is a #1 killer when we look at infant mortality. 88% of diarrheal deaths are due to a lack of access to sanitation facilities. This is 100% preventable. And tonight, we are looking for your support to fund pit latrines in North of Uganda. I love this photograph. When I last went to Uganda, the farmers were so proud of their latrine slabs that the whole village walked around with me to show me their latrine slabs, all ready and waiting to be put onto their pits. This couple also innovated a whole ventilation and a sloped 8 drainage. It's not rocket science that not having access to a loo is going to cause devastatingly poor health and exacerbate poverty, not to mention the stench and lack of dignity for these people. Pit latrines may just look like a hole in the ground with a concrete slab on top, but they are contributing to half-common sicknesses in the communities that we support. Plus, we're only asking you to contribute half of the cost of the materials, because the farmers contribute the other half, as well as their labour and enthusiasm to learn about hygiene and sanitation. Each pit latrine costs about £26, and we want at least 200 of them for our project in Uganda. So please, please dig deep and give generously to this project this evening. Thank you very much.